Welcome everyone. A couple of minutes and we will start the webinar. In the meantime, if you wanted to introduce yourself using the chat, you're more welcome to write your name, your title, and the country where you're working. Thanks. So I can see more people are joining us and some are already presenting themselves. Welcome, Madi from YEM Education Cluster. Also Lizzie from Ethiopia. Suleimani, welcome to this webinar. And I see Rania, Education Cluster Coordinator in Yemen. Verena, Child Protection Specialist from Germany. And also Ranjini from the Child Protection Area of Responsibility Somalia. I think it's time to start. I can see that we have a good number of people join us today for this very, very exciting webinar hosted by the Global Education Cluster and the Global Child Protection Area of Responsibility. So my name is Luca Fraschini and working for the Global Education Cluster as a capacity development focal point. The main objective of today's webinar is to introduce this important resource, the framework on institutional capacity strengthening for national and local actors. And also we will be lucky to hear some experience from 3 different speakers about institutional capacity strengthening. I can see also Peter, Karina, more people are joining. Abdullah, welcome everyone. So let's go to the next slide quickly to look at these, to look at the agenda for today's webinar. As I mentioned, we will have some opening remarks from Maria Agnese Giordano, Global Education Cluster Coordinator. Then we will have an overview of the framework by Fatuma Ibrahim. We will have 3 important experiences about institutional capacity strengthening from Nigeria and Iraq. And then we will have a specific section for question and answer. At the end, some summary about today's webinar key discussion points and closing remarks from Ron Powell, Global Child Protection Area of Responsibility Coordinator. Before we start, a few rules for today's webinar. Unless you are a speaker, please be sure to keep your microphone mute and your video off. I think you should not be able to unmute yourself, so this is already good. Speaker will try to be as much as possible on time with a different presentation. It is a very, very exciting 1-hour webinar today with a lot of different speakers, so we will try to be on keep the track of time. And also the webinar will be recorded and not made public, so don't worry, we're recording the webinar. And as I mentioned to you before, there will be a specific 50 minutes section for question and answer. So feel free to write down in the chat your question anytime, and we will try in that 15 minutes to respond to your question. Good. So, without losing time, I would like to invite Maria Agnese Giordano, our Global Education Cluster Coordinator, to give a quick introduction to today's topic and about, particularly about the prioritization of capacity strengthening, institutional capacity strengthening. So, Maria, over to you.
Thank you so much, Luca, and hello everyone, and welcome to this webinar and to the official launch of the framework for strengthening capacities of local actors. It's a pleasure to be here, and it's a pleasure to launch this framework. As you know, and I'm sure you know by now, that localization is a top priority for both the Global Education Cluster and the child protection area of responsibility. It has been a priority, a commitment in the Grand Bargain and other global commitments, but we can say proudly from our end that we walk the talk, and we have made many things happen thanks to our colleagues Kemal, Fatuma, and all of you in the country level clusters. So civil society organization, local actors are at the forefront of humanitarian response. They are key, you are key for any steps within the humanitarian program cycle, from assessment, analysis, response, monitoring, and so on. And in order really to improve access, quality of services, scale up of the response, this cannot be done without local actors. Also the linkages between humanitarian interventions and development, longer term programs are not effective without an active and effective participation of local actors. But we know very well that in order to for local actors to scale up and have access also to the needed resources to deliver services and play that meaningful role, we do need to work together to strengthen the core capacities of any organization, like our organization, organizational capacity for financial management, human resources management, monitoring, reporting, and all of that. So that's the main purpose of our work. We have recognized that without strengthening the institutional capacities of local actors, a lot of the talk around localization remains vague, remains theoretical, because you do need the means to be able to play that role. And clusters at the country level do have a central role in support of local actors, in support of certainly participation, inclusion, representation, leadership within the cluster approach, but also making sure that local actors have access through, for example, humanitarian pooled funds and other donors. They have access to the capacities and the resources to fully really fulfill that role at the country level within the humanitarian response and the cluster approach. And for this reason, we thought that a framework would provide needed guidelines, tools that could support cluster coordinators and member organizations and donors to make those decisions, to prioritize support and strengthening of local actors' capacities, capabilities. So it's a pleasure again to be here, and it's yes, with pride that we launch this framework together today with Child Protection AOR and with all of you. Thank you again for joining, and now I will pass the floor to my colleague Fatuma. Over to you, Fatuma.
Thanks a lot, Maria, for these opening remarks. So, as you said, Fatuma Ibrahim, the localization specialist from the Global Child Protection Area of Responsibility, will give us a quick overview of the framework. Over to you, Fatuma.
Thank you very much, Luca. Good afternoon, good evening, everyone. We are happy that you are able to join today. So my job is really to take you through very quickly the framework itself. How does it look? What does it do? And as Maria Agnesa has already said, localization is a priority for both the child protection area of responsibility and the global education cluster. But within that, we realize that many national and local partners need to have stronger operational capacity. And therefore, there's need to strengthen the institutional capacity. And so much has already been written about institutional capacity strengthening, but the how was lacking. So what we've attempted to do is to bring in the how. How can coordinators support this process for their members who are national or local partners? So there are three objectives in the framework. First, we set out the framework so that it can support coordination groups to be able to come up with strategies that can allow them to integrate institutional capacity into the humanitarian program cycle. Secondly, it provides costing for the different components of institutional capacity improvement areas. And this was important because people didn't seem to have a lot of information on how the cost of financial management mentorship or coaching would cost. So we have that. The framework also helps to identify areas where there's need to strengthen capacity. Is it going to be financial? Is it going to be human resource? Is it logistics? Because it provides instruments and tools for doing the capacity assessment from the very beginning. Second, next slide. So the framework itself, as I said, is providing the how. So one thing it does is to help you to identify the institutional capacity gaps within the process of the HNO, and as well as now providing solutions in the HRP. It provides the steps that you can use for institutional capacity strengthening. In fact, there are 5 of them, starting with the organizational capacity assessment, then coming to identifying what kind of courses that they need to go through, the service providers. So it suggests for you the modalities. It's very clear and very straightforward. And it also provides a list of some of the capacity strengthening areas that we've come to learn through the piloting that we did with some local and national partners, particularly in Nigeria. This includes financial management, risk management, governance, and so on. Most importantly, it provides a list of online training courses and also training service providers. And the training service providers can be international, can be local, and some of these courses can also be done face-to-face. But there's a huge emphasis on coaching and mentorship. So it's not just doing the formal training, it's going beyond that. It also provides information on how you can advocate for allocation of country-based pooled funds for institutional capacity strengthening. And most importantly, it helps to prepare partners for the OCHA due diligence, the HACT process for UNICEF and other UN agencies, as well as the partners portal. Next. In the framework, we've also tried to outline roles and responsibilities for the different actors. For at the global level, like for instance, we are saying we can advocate with other clusters to join hands, because we think if we have more voices coming together, it will be easier to influence, especially when it comes to advocacy for allocation of resources, resource mobilization, and also to provide guidance to country coordination groups. We also have outlined roles for the coordination groups themselves, what they need to do in order to start this process. We've also provided, next slide, we've also identified roles and responsibilities for the national and local members of the coordination groups. They have to be willing to be part of this process. I mean, it's not, they're not being forced, they need to be able to participate, they need to be able to respond to calls for proposals, prepare staff for the capacity strengthening, because it needs time. And also there are roles and responsibilities for the international members of the coordination groups. Next slide. So we have outlined the fact that they need to participate in these cluster discussions. They may not be the recipients of the training, but they can support the process. They can work with local actors to identify the capacity gaps. They can also develop outputs in the HRP project sheets that really focus on institutional capacity strengthening, and also work with local partners, particularly those with whom they are partnering, on how they can implement and monitor these efforts in terms of strengthening the capacity, institutional capacity of local actors. Thank you very much for your attention. There is much more into the framework, which we have already shared, and maybe some of you have already seen that. Thank you so much. Over to you, Luca.
Thank you very much, Fatuma. Thank you for this quick overview of the framework. As we said before, we are very lucky because we have 3 speakers from Nigeria, Iraq, to talk a little bit more about their experience regarding capacity strengthening of institutional capacity. So our next speaker is Abba Yusuf. He's the executive director and co-founder of the Grow Strong Foundation in Northeast Nigeria. Abba Yusuf, can you hear me? Over to you.
Yes, I can hear you. Thank you very much, Luca, for the introduction. And I'm just here to share my experience with regard to the institutional capacity strengthening, basically for Grow Strong Foundation. So as some of us know that Grow Strong Foundation is a youth-led organization, and we find it like, yeah, there is need for us to ensure that our capacity is being strengthened in programming as well as in operational ground. And this will enable us to enhance our financial management system and to be accountable for our partners as well as to our donors. And we find it like it is necessary for us to have to build a wider partnership and access direct grant from donors, which may lead to having a recognition among our governance as well as management structure, which will really help us to have a clear reporting line in the accountability within our organization, as well as to any of our partners that may come on board. So basically, that is the reason why we say that as GSF, we really need to strengthen our institutional capacity. Next slide, please. So in terms of the areas that was covered up during the mentorship, we are able to cover about 5 areas of which we require an urgent support, and that is why we reach out to the global area of responsibility to give us this very assistance and opportunity to participate in this program. So basically the 5 areas that we cover, which includes the governance, the finance management system, the human resource management system, resource mobilization, as well as program management. These are the areas now we cover in terms for the governance management, in terms of the governance system. The methodology that were used for the capacity or the mentorship training is basically online, and it almost lasted for 1 month, of which it is still also ongoing, whereby we go back to the mentors, the consultants, to ensure that there are any gaps or challenges we find, we reach out and then they advise and we reach forward. And for the financial management system, I think this is something that requires much attention and more time, because the consultant was able to work with us to review our finance policy, that is existing financial policies, to contextualize it to base our contacts, and then we reach out again to him for various training in finance management as well as discussion and way out. Basically, the mentorship took about 7 months. And then we also, for the human resource management training or the mentorship, is also a different consultant, which took him about 3 months to ensure that our human resource policy is being strengthened. So for this, I'm happy to inform you that we add additional national NGO, about 3 of the national NGOs also participated in this human resource training. And this training, it has a series of practical assignment that was given to us to do it on job in terms of recruitment process, how we do our advert, how we can bring the right people on board. And then for the resource mobilization, it was conducted online, and then there are a series of group discussion, and at the same time, about 3 national organizations also participated. We invite them to also participate, of which now they are doing a very good job, and it lasted for about 1 month. And in terms of the program management, it is still ongoing, of which we are going through an online courses for general program management cycles. Over the next slide, please. Yes, so yeah, in terms of the governance system, the impact, honestly, there are a lot of impact that we get over these 2 years of engagement. We improve on our the governance management system, which leading us to formation of a very good board, of which they do a very important job and provide the needed leadership. Our financial management system leading us to have a low risk by UNICEF hack team, and we have a significant improvement from moving compared to 2019 external financial external audit report, yes, of 2020. And then we recently get an approval by the Nigerian Humanitarian Pool Fund to access grant at the same time, currently implementing program. And then we lead on the NGO consortium, which we directly get a funding from the Alliance for Child Protection Area Responsibility to implement the project. And then GSF is now having a 3-year multi-year strategy plan, as well as a yearly operational plan. And we recently signed a PCA with UNICEF as a result of this improvement. Next slide, please. Yeah, however, I would like to share 3 major challenges as well as lessons learned that we encountered during this period. Our trained staffs tend to recruit easily by INGO as well as UN organization because of their capacity is being enhanced, and then they end up leaving. And then our governance system as well as management system put us in a very good place to get so many recognition from different stakeholders, both at the national as well as the global level. And then the mentorship has taken longer than expected as a result of the COVID-19 pandemic, as well as, you know, most of the donors we got on board, they support us through pro bono, and which make them to have other engagement, and they cannot concentrate now fully on the activities. I believe this is the little that I can share with you now, but however, if you need further clarification or more support, I'm always on standby. I'm available to provide more. Thank you very much for listening, and over to you, Lucas.
Thanks a lot, Yusuf. And a reminder to the participant, please feel free anytime to write here in the chat box any question. We will have 10-15 minutes to look at your question and try to respond. Thanks a lot, Yusuf. Let's move to our next speaker. Navriz Mahmoud from the Iraq Child Protection AOR cluster, coordinator of the cluster. Navriz, over to you.
Thank you so much, Luca, and thank you for listening all and for joining the session. Next slide, please. So we will try to share some of our experience in the CPAOR in Iraq, or the Child Protection Subcluster, and how we try to engage national actors and focus on institutional capacity and strengthening. Next slide, please. So first, we try to introduce this through linking the institutional capacity and engage national actors through the humanitarian program cycle. That's happening each year. For instance, we started to engage national actors who are child protection actors to be part of the multi-cluster need assessment. Under that way, they will receive technical support from REACH initiative in country, and they will understand better the importance of data analysis, of training new enumerators, cascading the same training internally in their organization. So we were able this year, in this 2021, preparing for 2022 HNO, we had 6 partners and more than 40 national staff engaged in the MCNA this year. After that, each year we conduct subnational level strategic revision of the findings to see where are the gaps and what are the national partners think about the current presence of CP actors or the gaps that are available, and the MCNA was not able to cover that. So the inputs, they know very well how much it will lead to the narratives and the finding of the HNO, and then will feed up into the HRP as well. On resource mobilization, we were able to have some level of advocacy with OCHA and country to include non-assessed NGOs to be part of the consortium of the country Pullet Fund in Iraq, and also consortium without having national actors as members are not included. Another good thing that we saw in the first allocation this year is we started to see a couple of national actors leading consortium themselves. And of course, as part of the scoring of each consortium, the consortium with technical capacity strengthening and institutional capacity strengthening are ranked higher. On implementation and monitoring, of course, this is an ongoing activity that we conduct with partner, and we train them how to monitor response, but how to monitor needs as well at the same time. And we include government actors in the same exercise. Next, please. Focusing more on the institutional capacity and what are the areas that mostly we try to focus on through the partnership that we receive either through the country Pullet Fund or through our communication with donors are mainly focused on human resource. Most of the national actors we found they don't have human resource policy. They don't follow the Iraqi labor policy that's available in country. They don't have child safeguarding. So these were things that we have worked on these, and some of them we made them interagency to roll them for all the national actors in country. There was some training about and policy writing about accounting policy, which are the policy that they use for accounting, which sometimes it is different from what the UN agencies are using in country. There are training on the project management, on monitoring and evaluation process of each project. And of course, there were trainings and policy written on supply chain and procurement, and some tools and means related to IT and information technology that the national partners, especially the government, were not able to have, which prevent them to. These were the main areas that we tried to focus on institutional capacity. Next, please. Now, the benefit of these on the CPAOR and the child protection intervention in country is huge. For instance, now we have a national actor leading interagency rollout in country. In terms of quality of services of the national NGO, we see it is getting more improved, and it's from a cost benefit or cost effectiveness, it's ranked very high. And also, when the national actor have capacity, we no longer are facing access issues or logistic issues for issuing visa to expand staff or colleagues, because the national actors now can conduct the work on the field. Another thing is they started to understand and contribute and dedicate resources to the national level and also on subnational level to the child protection coordination, which before it was totally ignored. But now they try to also draft that in the proposal that they are writing. Next, please. The lesson learned that we can say is I think most of national actors, until recently, they had no idea what is cluster approaches. So this is something it needs to be very well clarified and explained in the local language to the partners about what is cluster approach and what is humanitarian response overall. When it comes to institutional capacity, it is not the partners that they know it is important and they don't do it. It's mostly related to they don't know what is institutional capacity, how to build an organization organization, how to strengthen each department. That's why they don't do it. It's not intention, but it's rather than related to their limited knowledge. Now another thing is that the language is always a barrier. Not many actors have English speakers, for instance. Another thing is the partnership that is conducted is mostly between the UN agencies or the donors or the INGOs with the national actors, is mostly focusing on the area that is related or close to what the donor thinks. For example, the institutional capacity here is always focused on financial management, for instance, but much less on organization as governance. So I think just to a bit closing the presentation here, I think this framework came in the very right time to structure better our effort on country level and to give us a gate to go through. And I hope we see how it gets contextualized in different countries so we can exchange the information and learn from each other. Thank you so much for listening. Over, back to you, Lucas.
Thanks a lot, Navreez. Very big thanks for your presentation. Let's move to our next speaker, Benjamin John. He is the Program Manager Restoration of Hope Initiative with strong experience in designing, implementing education and child protection program in Northeast Nigeria. Benjamin, over to you.
Yeah, good morning, everyone. Good morning. And welcome to this webinar. I'm going to be talking about some of the reasons why we have to strengthen institutional capacity for our organization. And I'm going to be listing some bullet points, and I hope there will be questions that will arise. I'm ready to answer. So looking at why we need to strengthen institutional capacity, one is to measure up with other international organizations. We know that national organizations have been placed behind in terms of funding, in terms of accountability, in terms of implementation of response. So we need to strengthen our institutional capacity in order to measure up with other international organizations and approach donors together. And also, more than ever before, we've seen there is more commitment to the grant by gain by donors, by different governments, different Ministry of Foreign Affairs. We've seen that they are now more committed to the grant by gain. And for national NGOs to be able to benefit from the advantages that it brings, we need to strengthen our institutional capacity. We also need to do that to draw closer to direct donor interactions. Many a times when there is donor interactions, national NGOs are placed behind, and donors are not able to interact with national NGOs directly. But we know that if we're able to strengthen our capacity, we're able to draw close to these donors. We also have to demonstrate the capacity to fill in gaps at INGO's absence in different emergencies in different regions. INGOs might only have a plan to be there for some certain years. And if there is any gap that is created by their absence, national NGOs should be able to fit into these gaps. And national NGOs will only be able to fit into these gaps if we have demonstrated the capacity to fill into these gaps, or there's going to be a justification for INGOs to get more funding to continue their response. We also need to be accountable to beneficiaries. In whatever we need to do, our accountability to affected beneficiaries is important. And we need to strengthen our institutional capacity in order to be more accountable to them. We also believe that donor fatigue might arise, and donors might not be able to fund projects with high operational and headquarter costs. For different donor projects, we see there's a large cost for headquarter costs and operational costs. But we feel that if we're able to strengthen our capacity, donors might not have to be supporting headquarter costs, because we need a limited amount of money in order to run our programs. Next slide. We're also looking at the areas of institutional capacity that will be covered under this initiative. We've seen the framework for institutional capacity development, and we feel that as a national organizations, we might not be able to cover all the 11 areas, or we might try to bring down or reduce the 11 areas mentioned in that document to these 6 areas. including governance and legal structure, the financial management and internal controls, the administration and procurement, our human resource systems, the program management, and the organizational management and sustainability. One might ask, what led to these choices? One is to reduce organizational risk level with donors. We understand that when donors have to give grants, when donors have to give funds to implement programs, they do a capacity assessment or a due diligence. At the end, they try to measure the risk level they have with the partner. If we're able to build or strengthen our institutional capacity, it reduces our risk level from a high to a low risk. And to also allow for more trust in partnership with INGOs. Many times INGOs they take it as a risk to give national NGOs a multi-year funding. Even there is a multi-year funding for 5 years, 3 years, you find out that the INGOs only sign these national NGOs to implement using an annual renewal of partnership. They sign it for 1 year, and then after that year is completed, if you do well, they sign for another year again. But when we are able to strengthen our capacity, where the trust between us and the INGOs is improved, and they're able to give a direct 5 years grant to national NGOs. And it also allows for private sector funding due to a demonstration of organizational strength. When national NGOs are able to build their institutional capacity, they can approach private sector in country and outside country, and we're able to access funding from this private sector in order to implement our response. Next slide. So one of the factors that we have considered for this plan is that INGOs are committed to supporting the process. We want to be sure that INGOs are committed to supporting this institutional capacity process, not to see that national NGOs are trying to pick over the whole response from them. But INGOs are also committed to ensure that national NGOs have the ability to implement, not just through subgranting, but also in a consortium. Also, one of the factors is also that there is availability of funds for professional consultants. We believe that building or strengthening the institutional capacity comes in different areas, which professional consultancy might be required, and its funding is needed in order to achieve that. Also, the availability of funding for at least 2 years to implement the finalized plans. If an organization like ROHI is able to build its institutional capacity, we want to also be sure that we have funding for 2 years that can help to implement the plans that have been developed. We also want to see sectors or clusters support in the process to share knowledge, to know that, okay, knowledge has been shared, and then national NGOs are able to improve in what they do. Next slide. And the approach we're going to be using is through an organizational self-assessment using the standard global best OCA tool, that organizational capacity assessment tools. We're also going to be having some organizational consultations with other partners, INGOs and donors, and through professional consultancy. And for how long this is expected to take, we believe that at ROHI, the process is expected to take a period of 4 months, and within 4 months, the system is going to be strong enough to work and function while we measure learning over the next 2 to 3 years of implementation, and then provide inputs where necessary. Next. All right, so one of the expected outcomes from the capacity strengthening investment is want to see a marked change in the way ROHI manages projects to achieve its main objectives. We also want to see how ROHI is quickly able to scale up its operations and take more projects where required. We want to see an increased guarantee of multi-year response and staff are retained. We also want to see that beneficiaries are better supported. Next. All right, I think, thank you so much for listening. Thank you for your participation in this webinar. Thanks a lot.
Thanks a lot, Benjamin, for the interesting presentation. I forgot to mention, Benjamin, that you are part of the strategy advisory group of the Global Education Cluster, representing Nigeria Education and Emergency Working Group. Thanks again, Benjamin. Now it's time for any question that you might have for our speakers. Feel free really to use our chat box to raise your question. I don't see, and I will ask Kemal, Fatuma, can you help me to monitor the chat box in case I missed already some question from our participant today?
Sure, sure, Luca. We have one question from Sonia. Can you see it?
I saw before and then I missed it. I think it was about, if I'm not wrong, it was about the importance of institutional capacity strengthening. How can we make sure that national and local actors understand the importance of these institutional capacity strengthening, correct?
Yeah, exactly. I can read the question. How can we increase understanding of the importance of institutional capacity strengthening among national actors, including decision makers of the national NGOs?
Shall we ask Yusuf or Navriz or Benjamin to reply to this, to give us some, or Fatuma too, huh?
Yeah, yes, I think I can come in
Please,
here.
Yusuf. Yes.
All right. Yeah. So basically, in order to increase the understanding of the institutional capacity among national actors, I think that there is need for us to have a continual consultation and advocate with partners as well as donors to have like a specific resources for ICAs for institutional capacity strengthening to local NGOs. This is one process when there is a continual engagement between the donors to really have a clear roadmap, clear framework, or clear understanding of the where the institutional capacity is really required. I think this is one process that I can really suggest.
Totally
Over
agree.
to you, Lucas. Yeah.
Thanks a lot, Yusuf. Thank you very much. Navriz, Benjamin, do you want to add anything about this?
Yes, maybe just one thing from Iraq's experience. I think there is constant auditing. There is a branding strategy that the community currently are more aware of. Some of these national organizations do national fundraising or local fundraising. So they need to build up their own profile, and they need to convince the community to donate to them. And that's how we were able to engage with them and convince them that institutional capacity is very important, and it will impact their performance and on their organization's lifespan. So we saw very positive reflection from the decision makers in the country.
Great, thank you, Navriz. I saw a hand raised by Barbara Jamar. Barbara, can you unmute yourself?
Yes, done.
Welcome, Barbara.
Thank you, Luca. My name is Barbara Jamar, and I'm working as a Chief Child Protection in Cameroon. Also, sometimes double hatting with the CPAOR. And my question is linked to the situation we are in for the moment. UNHCR leading the protection cluster is taking more and more space covering the child protection AOR and GBV AOR. And they started a huge assessment of capacity building needs of NGOs, local and international. This being said, I would like to know how we can avoid any type of overlapping and sell this opportunity, which is huge, to our colleagues so that they will not become a kind of a bottleneck, if you see what I mean. So that's a little bit of the questions I need to prepare to answer to when they will come to learn about this opportunity. And thank you to you, colleagues, for presenting us. Thank you. Over.
Thank you, Barbara. Thanks a lot. Who wants to comment on Barbara's question? Yusuf, Navriz, Benjamin? or Kemal or Fatuma.
Thanks very much, Luca. I would like to come in, but I would like Barbara to kindly repeat the question again.
Yes, my question is how could we present this opportunity to our colleagues in UNHCR who are leading the protection cluster, because they are in the process since many months now, assessing the capacity building needs of our partners in the field. And they might come back to us saying that this opportunity is not interesting because they have already done everything that could have been. So please give me some tips so that I can continue to advocate and work on the institutional capacity building of our partners, even though we will be working on the tools of our UNHCR colleagues, obviously, but I need to present a rationale so that it is accepted. Thank you. I hope it was clear.
Yeah, it's very clear now. Thank you very much. I think in terms of UNHCR, it's really sitting and discussing with them. In fact, they are part of this process. They have also been participating in some of the discussions we've been having on institutional capacity strengthening. So it's not only their role, I mean, it's also the role of UNICEF, in fact, other international actors as well. But for UNHCR, the starting point is really to sit down and start discussing. It may be already that they've done the capacity assessment, so it's very difficult to go back. The next opportunity that comes up is the HNO HRP process, which even you being somebody who is double hatting can also initiate this discussion within the child protection area of responsibility meetings at the, I don't know, whichever level it is, whether it's at the northeastern where all this humanitarian crisis is happening, or at Yaoundé level, but this is how you can start the conversation. It could also be with other donors, not necessarily the country pooled funds. And it can also be with other international NGOs that are working there. Some of them are already actually doing this work. They are already supporting some of their partners to build their institutional capacity. So this framework is now something that you can use to start the advocacy. And it's not going to be a one-day response. It may take a bit of time to get people to really buy in, but what is important is that you have a resource that you can use and to start the discussion. I hope that is helpful. Otherwise, Barbara, we can have additional discussions with you bilaterally. Thank you. Over.
Thanks a lot, Fatuma, and thanks, Barbara, for raising the question. I see more questions in the chat. One from Agatha was about the fact that Yusuf, you mentioned that building capacity of local staff also goes along with staff then leading to work with international NGOs. So Agatha is wondering how to deal with these, for national NGOs, these, I guess, these issues, no? Yusuf, do you want to say anything about these?
Yeah, Lucas, I think this is a basic experience we experience, and it's very a tricky process. So one of the possible way forward that we put in place is to revisit the contract of these various staffs to really find a way that, yeah, this is how you should be working after going through this mentorship or the capacity plan, at least like some period that you really need to give back for a step down training. And another process that would advise for us to really follow now is to ensure that, yeah, when they move, you have to keep that relationship ongoing, to have a specific time for them to step down such training and then support the mentorship. And then lastly, yeah, the issue of motivation have to come in. Honestly, that's the real aspect why most of the staff did for either the international or the national or the UN agencies. So we really need to improve in our motivation for the staffing, and then this will give a better way of retaining such staff members. Over to you.
Thank you, Yusuf. And there is also a question from Peter. Hi, Peter, from the education cluster in Mozambique. If there was any specific experience in countries in specific training for national NGOs to write proposal to mobilize funding for this specific purpose.
Yes, I can take that one, Luca. We have 3 countries where this support was provided. Nigeria is one, and that support was provided by our partner Street Child UK. And then also in South Sudan, it was Save the Children. We had also this support in DRC, again supported by Street Child. And it did work very well. And in fact, as a result of that, there were more local and national partners whose project proposals were considered in the HRP process. Over to you.
Thanks, Fatuma. And then I saw in the chat, more than a question, is like a comment from Tom. Hi, Tom, is a long-term friends of the education cluster and child protection AOR cluster. I don't see Kemal. Fatuma, can you help me if there is anything that I missed? Any question? I believe that we are running a little bit late. So
I think those were all the questions, Luca, so we can move on.
Very good. Thank you, Fatuma. So let's move to the next, the final part of this webinar, today's webinar, with Kemal. Kemal, do you want to quickly summarize what we have seen, what we have discussed so far? Kemal, can you hear me? Yeah.
Thank you. Yes, I can hear you. Thank you, Luca, and thanks everyone. So just brief highlights from what we have listened so far. First of all, we listened from Fatuma Ibrahim, the localization specialist from Global Child Protection AR, on how institutional capacity strengthening framework that has been just launched helps the cluster coordinators and other stakeholders, such as the directors of local NGOs or national NGOs, as well as in their international partners, to identify key gaps in organizational capacities, such as HR and finance, and address them. Fatuma also stressed the importance of integrating institutional capacity needs and capacity strengthening plans in the HNOs and HRPs, the humanitarian program cycle, basically. The framework also outlines the roles and responsibilities of different actors, including the cluster coordination groups, the international and national members of these coordination groups as well. Then we listened from some implementations of the capacity strengthening process from different contexts. First, we heard from Yusuf Abba, the Grow Strong Foundation in Nigeria, speaking about the mentorship and online trainings they received to improve their institutional functions, including the governance, HR, program management, and finance, among others. One of the most key important outcomes from the program was that Grow Strong Foundation scored low risk in the UNICEF's micro assessment, hacked micro assessment, and they become eligible to directly access humanitarian input funds. They also have increased their capacities to better respond to the needs of their beneficiaries, as well as better HR, better governance and finance and administration systems. one key thing that was highlighted in his speech, as well as one of the questions asked, was the staff who are being trained, leaving the organizations for other international organizations, which is a challenge. And now we heard from Nawres Mahmoud, the Child Protection Co-Coordinator in Iraq, on the institutional capacity strengthening program implemented under the guidance and support from the Child Protection AOR in the Child Protection cluster in Iraq. Nawres talked about the impact of the program, which is basically increasing the number of national NGOs leading the consortia under country-based pooled funds, also increasing the quality of the response, the overall child protection response, and adaptation to remote modality, and also increased engagement and leadership of the engagement with the cluster, the national NGOs becoming more engaged with the cluster. She also highlighted that the national NGOs are becoming more aware of the cluster and the cluster mechanism, and also the institutional capacity strengthening is a key support for implementing such programs. Last, we heard from Benjamin John from Rohi organization in Nigeria on their plans for institutional capacity strengthening. They plan to improve their project management processes and scale up operations to support beneficiaries and have multi-year funding through these capacity strengthening programs. And they expect to have more financial stability and less staff turnover through their capacity strengthening projects. This is a quick overview of the highlights, and thank you all. Now back to Luca.
Thank you, Kemal. And I believe that we are almost at the end of this 1 hour webinar. It's 1 p.m. Geneva time. I would like really to thank you about your participation and to all the speakers. Before we close, I'm very happy to introduce Ron Powells, Global Coordinator for Child Protection AOR, for the closing remarks. Ron?
Thank you, Luca. Good morning, afternoon, good evening to all of you. The Global Education Cluster, as well as the Global Child Protection Area of Responsibility, we're very excited about the launch of this framework. We've made a heavy investment in the framework, and so it's great to see it come to fruition today. On behalf of the two clusters, I would like to thank all of you for having found time to join the launch today. And special thanks go to Yusuf, Nawres, and Benjamin, who shared their experiences on different aspects of institutional capacity strengthening with us today. There's a lot for us to learn from these experiences, and I'm really motivated to see the possibilities for strengthening the institutional capacity of national and local actors. As Maria Agnese said in her opening remarks, national and local actors form the bulk of the membership of the education and child protection country coordination groups. And therefore, investing in their institutional capacity is an investment in a more effective and efficient humanitarian response. As we all know, the COVID-19 pandemic has reinforced the centrality of national and local actors in the humanitarian response. And so the GEC and the global CPAOR will use this momentum to advocate with various donors and international organizations to invest in the institutional capacity of local actors. We need to use every opportunity that presents itself to advocate for investment in the institutional capacity of national and local actors and at the country level. We can include institutional capacity strengthening in the HNO and HRP process. This is one of the reasons why we wanted to launch the framework before the HNO-HRP process begins, so that there is guidance and reference on institutional capacity. At the global level, the GEC and the global CPAOR intend to use the new YASC guidance on strengthening the participation, representation, and leadership of national and local actors in the ISC humanitarian coordination to advocate and lobby for more investment on institutional capacity development. Once again, I would like to thank you all for having made the time to join this lunch, for our speakers, our panelists, our presenters, and I have the pleasure to close the webinar. Thank you.
Thank you, Ron, and hi everyone. Have a good rest of the day. And thank you very much for your time.
Have a nice time.